HMSA and HMSA Foundation have invested almost $8 million in the University of Hawaii to support education, research, and community outreach to advance the health of people in Hawaii. With HMSA's support, the University of Hawaii is helping families live healthy, educating Hawaii's future healthcare professionals, improving access to healthcare, and advancing healthcare quality. HMSA's support of programs such as Fun 5, Hawaii 5210 Let's Go, and Pili Ohana encourage keiki and families to make healthy lifestyle changes.
The Pili Ohana project is a community academic partnership between the Department of Native Hawaiian Health at the Johnny Burns School of Medicine and 4 community-based organizations. And it's a partnership that was formed over 11 years ago to address obesity disparities and ultimately diabetes disparities here in Hawaii, mainly with Native Hawaiians and other Pacific peoples. Private support has helped tremendously. As you know, with federal research dollars, they're only there to fund the research component of things. And often we do great research, but it's unable to get into real-world settings where it's uptaked and sustained. So private dollars really helps us to, one, begin to disseminate and get it out to the different communities. But with the funding, it also allows us to begin to develop sustainability plans or ways to address this, such as policy changes, and how do we go about doing that?
As a community resident along with community leader, I've seen the effects of chronic diseases such as diabetes, heart disease for many of our families here. And it was very important to community leaders to do what we could within our ability to help our families to live well, to live healthy, and live a long, full life. Early on with Pili Ohana, we had a family of 6, and every member in that family, it was a rather large family, and each one of them lost an average of 27 pounds, and one of them lost 37 pounds. So what it did for this particular family is it really brought to their attention, the need to take a real close look at family history, medical history, and really have a very honest conversation about, making the choice to live long and live well. So people have taken Pili Ohana and applied it to, their personal life, their families, what they choose to do as Ohana, and then outside to their colleagues at work and people in the larger community. So it's really, really impacted this community.
Since opening in 2012, students, practicing providers, researchers, and visitors have logged over 132,000 contact hours at the UH Translational Health Science Simulation Center.
The UH Translational Health Science Simulation Center, we call it the THSSC shortened. It's an 8,000 square foot state-of-the-art simulation center that we have located right here on UH Manoa campus. And what we do is we engage actors from the theater department, so they're students, to role-play patients. We also use high fidelity, these are the computerized mannequins, to replicate healthcare situations so that students and healthcare providers can come here and practice so that they can learn how to work together, learn about each other's roles, and provide safe, quality healthcare really to the people of Hawaii. I can't even imagine trying to teach students with this new healthcare environment without the opportunity to have simulation. When I went through nursing school many, many years ago, we didn't have such a facility. And what we had to do was we practiced on each other, and then any experience we got was just what we saw in the hospital. And I still remember my own story that the first week out of nursing school into my first job, my first patient was a respiratory distress patient who really needed to go to the ICU. And I was alone. I had this patient, never encountered it ever in my life. And I thought, oh my goodness, what do I do? So what simulation does, and having a center like this, it allows us to have people come out as professionals who have experiences and they're more confident. And because of those lessons learned, when they go out, I think they're going to be a better healthcare provider.
HMSA's support of the UH Maui College Oral Health Center, Medical Student Travel Fund, Hawaii State Loan Repayment Program, and Family Medicine Residency Program is helping to expand access to healthcare in rural areas, including the neighbor islands.
So the Family Medicine Residency Program started in 1994. The Department of Family Medicine of the medical school started in '92, and both are really created with the mission to train family physicians for Hawaii and the Pacific Basin, but also family physicians with a particular interest, skill, and aptitude for serving underserved populations and populations was facing a lot of health disparities. What makes rural Hawaii different than the rest of the rural United States is that we're an island geography. It's really different when you're on an island and you know that the patients that you're with may not have the funds to just fly to Oahu or to live on Oahu for extended periods of time, for example. So the advantage of training medical students and residents in these settings is, one, it actually sharpens their clinical skills because they need to really use all parts of their brain, eyes, ears, everything that we teach them to really make the best clinical diagnosis with what they have, and then use the resources that they have on island. If we don't train physicians in that setting, then, and if they do all of their training in Honolulu, then they may never really develop that skill to really relate and provide the best that the community needs. So that's why it's really important to have that type of training.
In 2002, HMSA provided $1 million to establish the HMSA Endowed Chair for Healthcare Services Quality at the John A. Burns School of Medicine.
My passion is about keeping people healthy. And in my training, my experience, I've seen so many times when people needed care but couldn't afford it. So what I'm doing with the HMSA chair is to really look at ways that we can make healthcare both high quality and affordable for people. For me, that's been using the support to look at making medication treatments available for people. It's one of the mainstays in which people can keep healthy for all the different conditions such as diabetes, hypertension, asthma that affect people in Hawaii. On the local level, I've looked at talking with physicians and providing a free clinical resource for all of Hawaii's physicians to know which medications are covered for their patients. We did a statewide survey and found that 100% of physicians wanted to help patients, but 9 in 10 said they didn't actually know which medications were covered or how much it would cost people. The website is called the Prescribing Guide, and it's been an amazing experience where physicians have written thank you notes to us to say, thank you for finally giving us information, for allowing us to help our patients. I think it's the people that I see every day that inspire me. It's the people that I'm there when they walk into my office, that I see in the hospital. It's their lives, and this is my community. I mean, there's no doubt that if there's anything I can do to give back to this community to make healthcare better for ourselves, our children, our parents, and our kupuna, I would do it. And, with the chair funding, it gives me a chance to do what I believe in, and that's what inspires me.
Mahalo to HMSA and HMSA Foundation for partnering with programs across the University of Hawaii system to improve the health of Hawaii.